Meet 28-year-old mother of 3, Gifty Afute. She delivered her first 2 healthy babies in a small clinic in Accra. But after her third delivery at the Greater Accra Regional Hospital, Gifty anxiously recalls how she was asked to test her baby for sickle cell disease. She says she had the shock of her life when the results came back positive.
I was stunned. I told her father the doctor said she has sickle cell. He was equally surprised because we do not have traces of this disease in our family. I did not want anyone to know about her status. Initially, my mother asked that I ignore the doctors.
Doctors explain that Gifty and her husband make up about 30% of the Ghanaian population that are said to carry the sickle cell gene. However, the couple had never checked their genotypes before procreating. Now, their daughter, 3-year-old Janice, not her real name, is living with the sickle cell disease.
She easily falls ill, unlike her siblings. If you do not seek immediate medical assistance, she gets worse.
According to the Clinton Health Access Initiative, 2% of infants are likely to be born with sickle cell disease each year in Ghana. But all hope is not lost, as health experts say timely and accessible newborn screening for sickle cell disease may be the answer. For this test, the baby's heel is pricked and a few drops of blood are taken on a special filter paper, which is dried and taken to the laboratory to be tested for different conditions, including sickle cell.
If a child is diagnosed early, there are some medications that you can put the child on. What we know about sickle cell disease is that it weakens a person's immunity. And so if the child receives the appropriate antibiotics, receives the appropriate immunizations, you can prevent them from developing those type of infections, because those infections, they end up killing these children. Now, the other thing that sickle cell does to the body is that it changes the way the blood flows in the body, and that can cause problems like strokes, which are known to be complications of the disease. And those strokes can even occur in children.
In high-income countries, newborn screening for sickle cell disease is universal. However, newborn screening programs have not been widely implemented in African countries like Ghana. The sickle cell disease prevalence here ranges from 20 to 30%, but majority of infants are not screened due to limited government capacity and funding.
It was Professor Kweko Hinifrim. He was the one who applied for a grant to start this project. We had a plan in place, and per the plan, we had decided that by 2015, every regional hospital in Ghana would be screening. But funds were actually not committed to that. So even though the plan was there, we're not able to roll out the plan. Before we started our project, we knew that 1 out of every 4 children who died in our facilities may have died from malaria. But I tell you, Nadima, quite a number of these people who died, the babies who died, may have died from sickle cell disease, but nobody ever diagnosed them.
Due to an MOU signed by the Ministry of Health, Clinton Health Access Initiative, and the Sickle Cell Foundation in 2019, free newborn screening sites were established in some selected hospitals. In the Greater Accra region, there are currently 5 testing sites. Data by the Ghana Health Service shows that as of March 2022, 16,499 infants have been screened under the program. Programs Manager for Newborn and Child Health at the Ghana Health Service, Dr. Edward Entry, says not all 16 regions currently have a screening site due to funding challenges.
Due to some of these challenges I've enumerated, the non-availability of a sickle cell clinic in some regions, we could not roll out to those regions, and the time elapsed, and therefore the funding ceased, or the funds available to return to the donor. We are still looking for resources to roll out. In the meantime, we are working with those regions to ensure that they set up a sickle cell clinic.
As Gifty prepares to take her daughter back to school after spending the entire morning at the hospital like every other Tuesday, she's thankful to have discovered the diagnosis of her daughter early, as she has seen a lot of progress since she began treatment.
Since she began treatment, I have seen a lot of improvement. Previously, the slightest complication gets us admitted at the hospital.
When the screening is made accessible in many facilities, the 50 to 90% of newborns with sickle cell anemia would not be at risk of dying before their 5th birthday. Reporting for GH1 News, Nadima Omar Uthman, Accra.